Anterior hip replacement is one of the newer ways of doing hip replacements. The reasons why people like anterior hip replacements is that they have a little bit faster recovery, a little bit less pain, and they can get back to life faster. What an anterior hip really is just a different approach to the hip. Why patients do so much better with it, you literally don't cut any muscle. So the incisions in the front of the thigh and in an appropriately chosen candidate for the procedure, we're able to go in between true muscle planes as opposed to going through a muscle or dividing or cutting muscle fibers, and thereby decreasing the sort of post-operative pain and recovery time that is associated with trauma to a muscle. We're able to do the procedure, discharge patients in one day, sometimes the same day. In theory, anybody's a candidate for it, but there are increased risks for certain patients. And so in our hands, we like to stratify our risk and minimize our risk as much as we can. And so I have that conversation with my patients.